Hi, Jessica.
Hi.
Nice to meet you. I'm Dr. Samita.
Hi, nice to meet you.
All right, how are you doing today?
I'm doing pretty well. I have a little bit of pain, kind of in my epigastrium area.
Okay.
But other than that, I've been doing really well.
All right, that's good to hear. We'll definitely check out the pain that you have in your upper abdomen. But since it is your new patient intake, we want to do kind of a full head to toe assessment.
Sounds
Is that
good.
okay?
Yeah.
All right, awesome. Okay. I'm going to start off with your vitals. Just going to put that right on your arm. Okay, just going to get a baseline blood pressure first. Okay. I want you to raise your hand and pump your fist 10 times, just like that.
Okay.
All right. I'm just going to support your arm. Yeah, just relax. And now we'll just pump up the blood pressure cuff again. And just listening for that first Korsakoff sound. Okay. Have you ever had issues with your blood pressure in the past?
I haven't. It's usually on the low side.
I noticed that it was 100 over 70. Have you ever had symptoms of like dizziness or lightheadedness?
No.
How much water do you drink a day?
Probably about 7 glasses of water a day.
Okay. That's pretty good. Okay, that's probably just your normal then. No hypotension. All right. Have you had any fevers recently?
No.
Good. Just putting on a fresh slip. I'm going to have you put this under your tongue. Close your mouth and just hold it with that. Perfect. I'm just gonna check your pulse. Right. Yeah, it typically doesn't beep. Oh, I have low battery. That's okay. Alright, your temperature is 36.25, which is within the normal range. Okay. Alright. Just going to pull on a pair of gloves, and we can start checking our scalp and then going down from there. That's recording. Okay. Let's take a look at your scalp here. Have you noticed any sparseness or thinning of your hair?
No.
Okay. Any patches of itchiness? Any dry spots?
No.
Okay. Okay. And then I'm just gonna percuss all over your skull and just let me know if you feel any pain anywhere, okay?
Okay.
Have you ever had any injuries to your head?
Fortunately not.
That's good. Right here. All right. Any pain or tenderness when I did that?
Not at all.
Okay, good. So while we're here, I'm also going to check your mastoid process, see if there's any squishiness. No, it's perfectly firm. Okay, I'm also gonna check your ear. Let me know if you feel any pain there. Okay, good. Have you ever had any ear infections?
I have.
When was your last one?
My last one was last winter.
Okay, and since then, no issues?
Since then, no issues, but when it's really windy and really cold, sometimes I get a little bit of aggravation.
Okay, and which ear is it?
My left ear.
The left ear? Okay, I'll definitely pay attention to that one. And let me also take a look at your face and your eyes. I want you to just look up. I'm going to check your conjunctiva. It's nice and pink. Sclera is white. Very good. Okay. Looking for any swelling or close your eyes. I'm just going to palpate your lacrimal apparatus here. Okay. Good. And then I'm just going to palpate your paranasal sinuses. Then let me know if you feel any pain there. Okay. And then up here as well. Okay, very good. We also feel your TMJ. Open up your mouth. Close. Open. Any pain when I do that?
No.
Okay, good. All right. We also feel back here. Open up your mouth. Close. Open. Okay, very good. It's opening up symmetrically. Have you ever had any issues with like grinding your teeth or clenching your teeth a lot?
No.
Awesome.
Yeah.
It tends to be really common. I know I have it. It's really great that you don't have any issues with your TMJ. Okay. I'm going to go ahead and palpate your lymph nodes. We're going to start with the ones back here, sort of the occiput ones, and kind of work our way post-auricular and pre-auricular. Any pain here?
No.
Okay. And I'll just go back here. Paratonsillar, submandibular, submental. Okay, that's just your gland there. And I'm going to move to the cervical chains. Just right here. Okay, and just a tight muscle there.
You can tell.
Mm-hmm. And here as well. Yeah, a lot of your sternocleidomastoid muscles are very ropey. Okay, but your lymph nodes are not enlarged. I'm just gonna have you move your head like this. I'm gonna go slightly deeper Okay. And this way. Okay. Now I'm going to check your supraclavicular, so I want you to just shrug your shoulders. Good. Okay, let them go. Okay. I'm also going to check your axillary lymph nodes. So I'm just going to check the front here. Okay. And then sort of the central lymph node. So it does seem to be slightly enlarged here. You're breastfeeding, right? So it might just be kind of the drainage of the breast milk. Yeah, so the central lymph node slightly enlarged. But do you feel any pain?
No.
Okay.
Nothing.
Good. Check this side here. Okay, not as enlarged on this side. Maybe just a little bit right here. Okay, let me also check. All right, very good. Okay, so we have baby here. So he'll be joining us for the rest of the exam. Now I'm going to listen to your lungs. So every time my stethoscope touches your skin, I just want you to take a deep breath in and out.
Okay.
Okay. Good. Just gonna check on you. Do you mind if I go under your clothing?
That's okay.
Just gonna pull it up a little bit. Okay, just on the side here. And the front. Okay. And up here. Okay. Okay, and then just one more over here in the front. Okay. Alright. Vesicular breathing throughout. I didn't notice any extra adventitious sounds. Yeah, these are gloves. I'm just gonna check your mom's skin. Yes. Okay, we're gonna just check your skin all over. Okay. Yeah, do you want to check with me? Alright. Just gonna check here as well. Nice uniform temperature. Okay, we're not gonna play with this, okay?
Hey, right. Hey, sweetie.
Take this one.
It's not for you, not for
Not
babies.
this one. Okay. Let me just check your capillary refill.
So many new things for you to see.
No. Okay. Very nice. Comes back right away. Okay. Other side.
Mars' heart is doing a good job.
And good circulation. Okay. Right. Okay, Jessica, now I'm going to be doing an abdomen exam. So I'll start just by inspecting your abdomen. So your umbilicus is in the center, it's symmetrical. I don't see any scars or any bulges. That's good. All right. Now I'm going to auscultate. Okay. I'm just listening to the bowel sounds. And just hearing a little bit of gurgling, just completely normal. Have you had any issues with your bowel movements?
Not lately.
Okay, good. Okay. All right. So no signs of intestinal obstruction or high frequency of bowel sounds. So now I'm just going to lightly palpate. I'm going to have you put up your knees. Just sort of bend your knees, both of them, so that we can reduce the guarding. Okay. Just going to bring this up slightly. Perfect. Okay, let me know if you feel any pain.
There's a little sensitivity there.
Okay. And anywhere else? Okay, I'm just going to go in a bit deeper.
Same
Same
sensitivity.
here? Okay. Okay, let me just see if I can palpate any masses here. And how would you rate your pain, 1 to 10, 10 being the worst?
I rated about a 7.
Okay, so pretty painful there then.
Yeah.
I don't feel any masses. I'm also just going to palpate your liver. So I want you to take a deep breath in and out. Okay, liver is non-palpable. All right. We also palpate your spleen. Okay, take a deep breath in and out. Okay, in and out. One more time, in and out. Okay, good. So spleen is also non-palpable. Now I'm just going to feel for your kidneys. Okay. I want you to take a deep breath in as well and out. So you're just feeling. Okay. The other side. Okay, take a deep breath in and out. Okay, kidneys are also non-palpable. Alright. So, is there anything that makes this pain worse for you?
Sometimes when I eat spicy food, occasionally when I'm having a glass of wine,
Okay.
I feel it makes it a little bit worse.
Okay.
It's just been worse the past couple of days, I would say.
Mhm.
It might also be attributed to stress. I have some exams coming up.
Okay, so you notice that it's getting worse with stress. Have you ever had this before?
I haven't had pain like this before, no.
Okay, so first time. And it's always just in this location here. Okay, so this is kind of the stomach pancreas area. Do you find that the pain ever radiates to your back?
I do sometimes feel a burning sensation in my back.
Okay. All right. And how would you describe the character of the pain? Is it achy, dull, sharp?
I would say that it's also a burning kind of sensation.
Okay.
It can be a little bit sharp.
Okay. Okay, that's good to know. Thank you so much. So that's it for the abdomen exam. But while we're here, you can bring your knees down. I'm just going to do a heart and lung exam. Okay, just going to percuss your lungs. I'm just going to raise your shirt slightly. Okay, check the other side. Okay, so all lung fields are resonant, which is normal. Okay, so now I'm just going to listen to your lungs. So we'll start up here. Every time my stethoscope touches your skin, just take a deep breath in and out, okay? Good. Okay. Just going to come down here. Okay. Okay, good. I wasn't able to hear any crackles or any rails releasing. It was just normal vesicular breathing. Okay, so now let's listen to your heart. We'll start with the aortic region. So that's just around the second intercostal space. Okay, right here. And then on the right side. And you can just breathe normally and just listening for any murmurs or any extra heart sounds. Okay, and then we're going to check the pulmonic valve. Okay, good. And then we're going to head down to the tricuspid valve, which is around the fifth intercostal space. So I'll just write it here. Okay, there we go. Okay, and then the mitral valve right there. Okay, your heart sounds great. S1 and S2 sounds are there. No extra S3 or S4 sounds. And I didn't hear any murmurs. Okay?
Great.
I'm just gonna actually listen to it again with the bell.
Mm-hmm.
And just very light pressure. Okay, good. Down here as well. Sorry. Just lifting. Okay. All right. While we're here, I'm just going to listen to your carotid artery. Okay. Pulse is breast 2 plus. Now let's listen to if there's any bruit. No. Just listen to the other one as well. No signs of bruit. All right, Jessica, I'm just going to check for your pupillary reflexes, so just look straight ahead for me. And looking for that constriction there. And then looking on the other side. Let's try that again. Okay, perfect. And then just measuring your pupils, seeing how many millimeters diameter. Oh, 6 on that side.
Mm-hmm.
And 6 as well. So they're equal, round, and reactive to light. Alright. Actually, while we're here, let's do an age test. So I want you to look at the tip of my pen. Don't move your head, just follow with your eyes, okay? Good. I'm just looking to see if you have any nystagmus, especially at the end of the range, which you do not. Very good. Okay, now we're going to do accommodation and near reaction. Look at the pen, and then look at the wall behind it, back at the pen, wall behind it, and then we're just going to have you follow the pen closer and closer and closer. Very good. All right.
That one's funny.
Also going to do peripheral visual fields as well. So I'm going to have you cover this eye. Yep. And look directly into my eye here. Just gonna find, so you're gonna let me know when you see the wiggling tips of my fingers, okay?
Okay. Now.
Good.
Now. Now.
Okay. Same eye?
Same eye?
Yeah, same eye. So just finding, okay.
Now.
Good.
Now.
Okay.
Now.
Alright, switch eyes. Again, look into this.
Now. No.
Good.
No. No.
Just trying to find it. Okay. Here we go.
No. No. No.
Okay, look at my eye. Let's do that one again. Okay, let's do that one more time.
No.
Good. Okay, perfect. So, just make a few notes here. Visual fingers intact bilaterally. Jessica, now we're going to look into your optic disc. I want you to look straight ahead at the wall there again. So I'm going to start by looking for your red light reflex. Start out a little bit more. There we go. Okay. Good. Alright, just coming up closer. Good. Alright, okay, I see the optic disc. Just following the veins. Looking at the retina. Alright. I'm just gonna have you take a break.
Thank
I'll
you.
actually move on to the other eye and then come back. Right? Again, look straight ahead.
Mm-hmm.
Okay, red eye reflex is present. Coming right up close. I see the optic disc. I see arteries and veins converging, no nicking present. Looking at the retina, I don't see any hemorrhaging or any spots. Okay, very nice. And I'll just come back to this eye. And at the end of it, I'm just going to have you look into it for 1 second. I'm just looking at the macula and fovea. Okay. Sorry, let's try that again. There we go. Good. Now look into the ophthalmoscope. Good. Thank you. Other side. And look into the ophthalmoscope. Good. Okay. No issues with your eyes. Your optic disc is nice and clear. No blurry outline, no bulging. So no papilledema there. I didn't notice any drusen spots or any kind of exudates.
Okay.
Yeah.
Good news.
Have you ever had any issues with your vision or like any kind of visual disturbances?
No, I do wear contact lenses, and
Okay.
my right eye is weaker than my left eye, but
Mhm.
with contacts, they're pretty good.
Okay, so in terms of vision?
In terms of vision, with contacts, I think I have pretty good vision.
Okay. Do you want to check just in case?
Sure.
All right. Cover this eye.
Okay.
It might be a little difficult after the ophthalmoscope, but let's do our
Let's
best.
try and see. Okay,
Just
I
read
can
the-
do the third row from the bottom.
Okay.
Okay, so I see 3, 7, 4, 2, 5, 9.
Okay. And cover the other one.
Okay,
And I want you to read that same line backwards.
okay. Okay, now that 9 is an 8. 5, 2, 4, 7, 3.
Do you want to try this one there? The one lower?
9, 3, 7, 8, 2, 6.
Okay. Do you want to try that one?
4, 2, 6, 7, 2, 9.
All right. So your left eye is 20/25 vision, and your right eye is roughly 20/30.
Okay.
Okay. And let's do. Okay. So you said this ear was the one that was bothering you, right?
Yes, I had an ear infection last year and it's pretty much resolved, but every now and then it gets a little bit aggravated.
Okay. So let's take a look into this ear here. Oh, the light's not on. All right. So I can see the tympanic membrane. It's not bulging. I see the cone of light. Right bottom corner. I don't see any erythema, no cloudiness. It's just a bit of serum and wax buildup near the entrance. Okay. Let's check the affected ear. Okay, see the tympanic membrane, cone of light at the bottom left. I do see a little bit of, on the right side, sort of more of the internal canal. I see kind of like a dark buildup. I'm not sure if that's serum and wax or if it's something else, maybe a scar from before. Okay. But there's definitely no bulging in the tympanic membrane, and I don't see any erythema, so I'm not too concerned. That's probably just a scar from a previous infection. Yeah, if you ever have any recurrent symptoms like that, or if you notice that you're having any pain, or if your lymph nodes are swollen, be sure to come in and we'll get it checked out again, okay?
Sounds good.
All right. Okay, just gonna take a look into your nose. Have you had any issues with your nose?
No.
Okay, nice and pink. Good. Okay, now I'm gonna look into your mouth.
Okay.
Just gonna grab one of these sticks. I want you to just open up your mouth and say ah. Good. Just one more time, I want to look at your tonsils. I can't quite see your tonsils. Have you had them removed?
No.
No? Okay. Let me just try one more time. Say ah. There we go. Okay, they're definitely not enlarged. I saw the uvula was midline. Now let me take a look closer at your tongue. So I'm just going to now move your tongue side to side. Good. I'm going to look below. Okay. And look at your teeth. Okay, gums are nice and pink. Have you had any issues with any bleeding gums or anything like that?
No.
Good. Okay, just open up your mouth a little bit more. I'm going to look up here. I haven't noticed any nevi either, which is good. Or any sores. Okay, great dental hygiene.
Thank you.
Okay. So I'm just making a few notes about your abdomen pain. So it's epigastric, burning sensation about 7 out of 10. And it just started a couple days ago.
Mm-hmm. I feel it in my back. Also feels like burning pain.
Mm-hmm.
Yeah, it's gotten worse over the past couple of days. I have been nauseous once or twice.
Okay. And do you feel the nausea along with the abdomen pain?
Yes.
Do you get any headaches with that?
No headaches.
Okay. Any anxiety?
A little bit of anxiety because I have some tests coming up that I don't quite feel prepared for.
Right.
Yeah, and I also just recently moved, so I'm like doing 2 things at one time, and just don't quite feel settled in my space yet. So just trying to get settled and then having things all over the place while I'm trying to prepare for these exams has just been kind of a lot on me.
Absolutely. Thanks for sharing that. I'll try to help you as much as I can on my part. Would you like any counseling help or anything like that?
Sure.
Yeah, I could definitely give you a referral. And as for the abdomen pain, I'm going to run a few lab tests, okay? We're going to check for your H. pylori. I'm also going to do a CBC, a urinalysis. We'll do some other tests like vitamin D, especially now since it's winter time. TSH. I'll also check your liver enzymes just in case, even though your liver was non-palpable. I just want to check that, as well as albumin. Yeah, so we'll get all those tests. I'm also going to prescribe DGL, which is a form of licorice. It's just going to help to coat your stomach in case it is something like peptic ulcers, which is at the top of my differential list.
Okay.
So we'll see if that helps at all, and hopefully we don't have to do any invasive tests.
Okay.
We'll see if the H. pylori comes back positive either, and if that does, then we might have to prescribe an antibiotic. But we'll start with this, so a counselor, and just running some of these lab tests. Hopefully, it's just the stress kind of aggravating the abdomen pain.
Thank you, doctor.
Thank you so much. Thanks for coming in, and I'll have all the paperwork prepared for you in the front.
Okay. Thank you so much.
Take care.